everyone. Welcome to our new session where we will discuss orthopedic surgery and how to stay active while we age. We are glad to have with us today Dr. William Granberry. He's Associate Professor in the Department of Orthopedic Surgery at Baylor College of Medicine in Houston, Texas. He currently serves as the Chief of Medical Staff at Baylor St. Luke's Medical Center Hospital. Welcome, Dr. Granberry. We are pleased to have you with us today.
Thank you. I'm glad to be here.
Thank you. So, Doctor, can you tell us briefly what is orthopedics first for the public to know? What is it?
Well, orthopedic surgery is the discipline in medicine that interests itself in the musculoskeletal system of the body. So it involves not only medical treatment, but also surgical treatment of ailments of the musculoskeletal system, whether it be traumatic problems or arthritis, degenerative problems, or congenital problems. Okay. We also treat, those rare diseases that affect the musculoskeletal system, like rheumatoid arthritis or gout. And so it involves both surgery and medical treatment.
Mm-hmm. So, Doctor, what is the difference between a doctor and a surgeon in this field?
Well, a surgeon is a medical doctor and a surgeon go to medical school. Mm-hmm. And at the end of medical school, medical doctors become trained in mostly medical treatment, not surgical or treating with your hands. And then the surgeons learn how to do surgery or practice and study that for several years after medical school. Mm. So they gain other skills other than just the knowledge of how the body works and how we treat it.
Mm. Okay. So, Doctor, is we hear about sports medicine a lot lately, yeah. Essentially. So is it part of orthopedic medicine or it's a different school?
No, that's part of orthopedics as well. So sports medicine involves treating the injuries that happen during sports, but also focuses itself on training and developing the right strength and endurance and specialties for any type of sport. Okay. So yes, it involves sports medicine heavily.
It is. Okay. So when does a patient with joint pain, we know that most of people while they age, they have joint pain. When do they need orthopedic treatment or surgery?
Well, that's a really good question, and it's hard to answer specifically because it differs depending on the joint and what sort of pain it is. I would say if you have pain after an injury that lasts more than a day, you should go see an orthopedic surgeon. Mm-hmm. If you have, alternatively, if you just have a pain from jogging or playing tennis with pain in the shoulder or something like that, if it bothers you more than a few days or a week, then it's probably prudent to go see a physician after that, mm-hmm. An orthopedic surgeon.
Okay, but some people have like chronic pain, joint pain, I mean. So this is due to what?
It's either due to some type of arthritic or degenerative process, mm-hmm. or due to some type of just inflammation. Mm-hmm. Some people get a tendonitis or an inflammation from improper training or improper stretching, etc. And those are things that are easily controlled. Arthritis or degenerative problems are a little bit more difficult because they tend to be progressive in nature. Yeah. Okay. And hence, you have chronic problems, mm-hmm. chronic pain. And sometimes we're able to resolve these situations easily, sometimes not.
So, Doctor, we know that arthritis, for example, it's very difficult to diagnose. So,
Well, it's not as hard to diagnose as it is to treat.
To
I mean,
treat also.
yeah, since it's a degenerative problem, you know, if you have pneumonia and you know you're a medical doctor and you go see your doctor for pneumonia, he gives you an antibiotic and then your lungs are fine; they're back to normal.
Mhm.
But in the case of arthritis, when you go to see the doctor and he gives you a treatment, well, you know your joint isn't back to normal, but the orthopedist can help you manage the pain and the difficulties, and there are some um, surgeries that can be done for arthritis, for example, a joint replacement that do make a difference, but it doesn't make it normal.
Mhm. Okay. So, doctor, we know that ankle and hip and knee replacements are the most common surgeries where we replace an injured joint with a prosthetic. What are the complications of such surgeries?
Well, the most common complication is an infection,
Mhm.
and the body doesn't like foreign material inside it, and so the if it becomes infected, it can attach itself to that foreign material. It's very hard to get rid of. So we go to great lengths to prevent infection, special operating rooms and antibiotics and special treatments to the skin and everything to prevent infection. And so at our hospital, the infection rate is 0.5%. So it is very uncommon, but it is a difficult thing to treat.
Mhm. And how successful is the procedure in general?
Oh, they're very successful. In fact, they've done a study looking at how successful an operation by how difficult it is to perform on a patient. And uh, unfortunately, the most successful operation is cataract surgery because it's
Okay.
very easy, it's very low risk, and it creates a very different. It really improves the function of the eye greatly. So that's the first. The second is a hip replacement
Okay.
because operation is easy. Well, not as easy as a cataract, but it's nowadays easy to recuperate from, and it completely changes your pain level and function, et cetera. And then the third is a knee replacement. So we like to say in orthopedics that we have some of the most successful operations that we have in medicine.
Mhm. And what is the recovery phase or time after the procedure? For example, for a knee replacement or a hip, it depends on maybe it depends on the surgery, I think.
Well, it depends on the joint. So
The
hip
joint.
surgery is easiest to recover from. It's completely enveloped in muscles, and the joint motion is very simple. It's a ball and socket. And with the implants we use today, we allow weight bearing immediately. So the patient after hip replacement can get up and walk the next day. Same thing with the knee replacement and ankle. The knee replacement actually takes the longest to fully recover from, and that has to do with the more complex motion of the knee
Mhm.
joint. There are a couple of moving parts. The patella has to be replaced as well, the kneecap, and the stiffness in the knee lasts for several months afterwards, unlike the hip and ankle, which really, within a few weeks feels normal.
Mhm. And is there any chance that a person that cannot have a joint replacement? What are the conditions to have a replacement? I mean,
Right. We call them contraindications
yeah.
for having, and one of them is a history of a previous infection.
Mhm.
And so that has to be controlled very carefully. The second contraindication is the bone has to be of a quality that will support the implant. And so in some diseases, particularly rheumatoid arthritis, there is often a weakness in the bone that won't allow it to support the metal and plastic implants. Um, and the other contraindications really involve medical issues. For example,
Yeah.
someone who has bad heart disease and can't withstand the surgical intervention, or somebody who has lung problems, et cetera.
Mhm.
Those are other contraindications, mostly related to the safety of the surgery, the general anesthetic itself.
And is age a contraindication also or not?
Well, I would say it's a relative contraindication. So we are replacing joints into patients in their 80s. But the reality is that when you get 80 or 90 years old, you're not that active, and so those people don't really want to have an operation that might be dangerous to them physically, because they don't really get around that much, and it doesn't hurt as much if you're not that active. So.
Okay, so doctor, what are the latest technologies in the market now for the joint replacements?
Well, the latest thing in the market now is this, what they call robotic control. So one of the things we have figured out is that the more accurately these implants are placed and matched to the bone, the longer they last. And so with robotic control, we can be very accurate with how the bone is prepared to accept the implant, how it's cut, how it's milled to for the implant to sit on it. To mention the other complication that we don't think about initially is that these implants are metal and plastic. I mean, they're just inert materials that over time will wear out or loosen up or lose function. So the other complication is the reality is that they won't last forever. So that's why we don't do it in 20-year-old people, or try not to, because we know that we'll have to be revising that at some point.
Okay, so when do you decide to go to a traditional surgery instead of robotic surgery? What are the indications?
Well, I would say at this point, we're still studying exactly who the best patient for robotic or traditional surgery, and a lot of it depends on the surgeon's preference. When we compare results between traditional or robotic surgery, the improvement is incremental. So a very good traditional surgeon can do almost as good a job as the robotics device can do. So there's still a controversy and a discussion going on about what exactly is the indication, who's the right person to have a robotic surgery.
Okay, so and what is the recovery period after these procedures? It depends on the age, on the patient,
on the joint too. As I mentioned, knee replacements take a little longer to get over, but in every patient, we have them, out of bed, walking on it the day of, or certainly the day after surgery. So we start rehabilitation right away. And, in general, surgery, an incision takes a couple of weeks for the skin to heal and maybe a month or 6 weeks for all the swelling and everything to resolve. The point is we get people up and moving, almost immediately.
Okay.
Yeah.
So you were saying that, for example, you try to avoid doing this operation to a 20 years old. So what are the other treatments you use, for example, for a football player that has a knee problem?
Well, if it's a degenerative problem, we give them a cortisone shot or a hyaluronic acid injection or other treatments, and try to get them along until they're in their 40s or hopefully 50s, and then we'll do the replacement.
Okay, so doctor, with a joint replacement, for example, the person will go back to his normal life. I mean, sports or he has to have some measures to take.
Well, I would say that it's not generally recommended to go back to sports after a joint replacement, because again, depending on your age, generally maybe these things will loosen up or wear out, and so you have to be a little bit careful with them. Now, that a person in his 60s or 70s, their sport is going to be walking the dog, which is okay. but going back to play football or be a baseball player, a soccer player,
No.
It would be allowed only on a very gentle basis, not
Okay.
a full 100%. Yeah.
Okay. So what are the prevention measures that a person, we know that prevention is key to avoid medical problems. So what are the prevention measures that a person should take to avoid orthopedic problems?
Well, I would say that the answer to that falls into two categories. One is, preventing an injury. And the best way to prevent an injury is to train properly, and that includes stretching and muscle activity that allows you to play what you're going to play. And the second bucket of that is the arthritic or degenerative process that happens over time too. And so to prevent arthritis, the two key things are weight, and we know that knee arthritis is very common in heavy people. And the second thing is to not smoke cigarettes. And smoking really accelerates arthritic change in joints and makes it much more difficult to do the surgery as well. So those are two things, and avoiding injury.
So can vitamins, for example, supplements can help with this also, or not?
Well, certainly there's a lot of lay press, public press about taking vitamins or glucosamine or hyaluronic acid, and these have been studied extensively and have a very small effect. So it's not dangerous to do those things, but the effect may not be what you hope. Okay. So it's certainly to take. Now, one thing I'll say is that it's very helpful for people to make sure that they have enough calcium and vitamin D, because that helps keep the bones strong. But when it comes to the joints and ligaments, taking vitamins has not shown to significantly decrease the degenerative process or injuries. So it's helpful, but
yeah. And what about collagen, for example? Because we hear about collagen supplements. Everyone is taking collagen for the skin and for the joints also. So is it true or not?
Well, again, yeah, that's the same. It's the same thing. I mean, it makes sense if you take a collagen or hyaluronic acid. That's the compound that's found within cartilage.
Okay.
It would help with your joints, and certainly there is a very small effect. So it's helpful, but it's not cure all.
So, doctor, what are your advice to people to aging for adult people to stay to safeguard their joints in the future? For example, a person in his 20s to 30s to 40s to be able to stay active till he reaches 80s or 90s.
Well, that's a really good question. The recommendation is to stay active, to stay fit, thin, not get too heavy, to not smoke, and to do regular exercise. Anything, and I think the recommendation is about 20 or 30 minutes a day or 5 days a week, and to also include not only exercise but also stretching. And in America, it's very popular to do yoga these days, or Pilates, and those are things which help keep the muscles limber and the joints mobile, and those are very important things to do. So in a young person, I would say stay active and try to avoid injury, and then for an older person to stay active, but to do a weight bearing exercise, 5 days a week, walking or jogging, or also swimming helps as well too. So those are the things. Okay. Stay healthy and eat healthy.
Okay, and one more question, doctor. Is there any sports we should avoid? For example, it can be aggressive to the joints, maybe at an early age.
Well, I would avoid boxing.
Okay. I do kickboxing, so I should stop.
Well, no, I mean, as long as you're not being
Yeah.
in your face or something, but any exercise is fine. I don't think there's, you know, some things are a little more dangerous than others, rock climbing or things like that. But any exercise is good. There's really not something to avoid. As you get older, you probably should avoid, you know, heavy impact or cutting things, because those have a higher chance of injury to the joints and the ligaments.
Okay.
But no, I don't have a.
So weight lift is safe.
Well, I mean, it can be, any sport can be overdone, you know, certainly, but weightlifting within limits, within the tolerance of your body to push is fine.
Okay, doctor.
So focusing.
Yeah. So thank you, doctor, for your time, and thank you for your information. It was a very informative interview. Would you like to add anything?
Well, no, I think that both covers it. There's a website. So I'm part of a society in the United States called the American Academy of Orthopedic Surgeons. So we have a national group, and they have a wonderful website which has a lot of information on it for exercises and stretches and something like that. So it's just the initials, AAOS.org, I think. And that's
it will help people have more information about how to stay healthy and
right.
active.
And it's not commercial, you know, it's just good advice from doctors. So
Thank you very much, doctor.
You're welcome.